This episode has been brought to you by Fornos Law Firm, devoted to optimizing your legal results at fornoslaw.com.
Welcome to Pushrim Life After Injury podcast for July 19, 2013, episode 29, Psychological Perspectives. I'm Ray PIZARRO.
I'm Boris DEL CID.
And I'm Ricahrd BELL.
We'd like to thank our community once again for being with us. On this episode, we're going to be talking about the psychological perspectives of spinal cord injuries. And with that, we have a special guest that we brought in that's going to be able to enlighten us and talk a little bit about her experiences with spinal cord injury patients. But before I do that, I'm going to go ahead and give you a little background on who she is. Dr. Sarah FRALEY is a staff psychologist at the Long Beach VA health system. She has provided psychological services in the spinal cord injury/disorder service for the past 8 years. She's also the director of the SCI peer mentoring program at the VA. She received her doctoral degree from the University of Iowa in counseling psychology and lived in California since 2003. So with that, we welcome Sarah FRALEY to the show.
Thank you very much.
Yes, Dr. FRALEY, thank you very much also for having us as your guest at the social hour at the SCI peer mentoring program at the VA hospital.
It was great to have you guys.
Very nice.
That was fun.
And I'll be asking you to come back.
Thank you.
No, yeah, we appreciate you taking time out of your busy schedule. I know it could be really hectic at work and with meetings and just seeing everyone there. So we're going to start off by maybe going down the list and talking about, asking you a few questions that are kind of poignant and bullet points, if you will, about SCI and the psyche. So the first question I want to ask you is, what is the role of of psychology within a rehabilitation setting after SCI?
Mm-hmm. Well, it's definitely different than if a person seeks out psychological services for a specific mental health problem. So, somebody coming in to see an outpatient therapist. So, first of all, at least at the Long Beach VA, the psychologist is an integral member of the treatment team. So that team includes physicians, nurses, social workers, rehab therapists, and others working, towards this global treatment plan. So we're not just a consult service. We're there, to meet with anybody who comes through our doors. So it's more kind of normalized, It's not because they have a problem. It's because we see everybody. Mm-hmm. So my particular role is not, to really do intensive psychotherapy. So some people wonder, she's going to pick my brain and, I'm not really interested in that. Mm-hmm. But really, what I'm there to do is, really identify and treat any psychological barriers that might be there that could prevent the person from taking full advantage of the physical therapies that they're really there to do. So that's really their main purpose in being there in rehab. Mm-hmm. So, oftentimes, there's that window of opportunity for physical, gain or recovery. And if there's a psychological barrier that could get in the way of that person really participating fully and being motivated for those therapies, then we want to make sure we're addressing that as they're going through therapy.
Great.
So.
Excellent. Yeah. Next question I have is, how would you address the patient who, is newly injured and is just told they'll never walk again?
Yeah. It's a great question and one that definitely comes up. And I would say that as much as possible, I'm really there to sort of meet the person where they are. So, to listen, to process what they're thinking and feeling at that time. And I also try not to assume that type of news for them is necessarily negative or positive. So for some people, people react in very different ways. So for some people, getting that type of news actually makes them feel more motivated for therapies and say, okay, if there's a chance, I'm going to put my all into this, So if you assume that, this is the worst news in the world for you, right? It's not the right assumption for every person. But then of course, for other people, it does make them feel more depressed or more hopeless, and, lose motivation for therapy. If they feel like it's not going to help anyway. So I think, okay, why do the therapy, if I'm not going to walk? So it's really individual. And I think, a lot of people going through that process in the hospital, they have their support people there and their, friends and family who might be saying, come on, have some hope and everything's going to be fine. You're going to be fine, And so my role on the team is to be at least one person in their life at that time that's not trying to make it all better. That's not trying to rescue them from that feeling, and just let them feel whatever they're going to feel.
And we all were
and be
there.
Okay with that.
And we all were there at that time. You guys remember when the doc came in and was like, yo, this is permanent.
I have to apologize because I wasn't very nice. But not to you, but to, the
Like
one who saw me.
Yeah.
I was pretty. Anyway, so my next question is, what is PTSD, and is it something that occurs in a civilian who's had a traumatic accident? And if so, how is it different from someone who's on the battlefield who suffers that condition?
Right. Well, it's a really big question. And, obviously there's been a lot of attention in the media on PTSD, with all the service members coming back from Iraq and Afghanistan. And it's really been, in the news a lot. And, a lot of those folks have been through multiple traumas. So we hear a lot about it, but basically it's categorized as an anxiety disorder. And basically it's a situation where a person has experienced a life-threatening event or trauma. So that could be anything from a physical injury, a sexual assault, a natural disaster, earthquake, hurricane, whatever, or even witnessing another person being injured. So it doesn't even have to happen to you in order to get PTSD. So there has to be that initial trauma. And then basically to kind of progress to PTSD, that anxiety has to kind of continue after the initial sort of aftermath of the trauma. So usually the criteria is like 1 month. So if you're still experiencing that, really intense anxiety a month after your trauma, then, you're kind of moving towards PTSD. So the symptoms, some, may be familiar, but, one sort of category of symptoms would be re-experiencing the trauma. So that's things like flashbacks or nightmares or just like intrusive thoughts coming in that you just can't get rid of. The second thing would be avoidance. So like basically avoiding things that might remind you of the trauma. So, a lot of veterans, have actually avoided coming to the VA ever since they were discharged from the military because they didn't want anything that reminded them of the military. Because that was related to their trauma. And sometimes they come, 20 or 30 years later and then they're like, oh, it's not so bad, but, so there's that avoidance. And then there's the last sort of cluster of symptoms is physiological reactivity. So that's things like chronic sleep problems, irritability or anger, hypervigilance. So like, you're aware of everything in the room, you're on guard, right? Or that jumpiness, like there's a loud sound and you just jump. So, some people don't meet full criteria for PTSD, but they still have some of those symptoms and they're still really distressing to them. So sometimes like, oh, well, you don't really have PTSD, but even if you have some of those symptoms, you deserve treatment and, there are things that can be helpful. In terms of the kind of second part of your question, in terms of combat versus civilian life, we certainly have veterans at our VA that have been through one or the other. So they're not all people that were injured during their service time. But I think the main difference is that for service members, especially those who've been deployed and are in a combat area, their lives are basically at risk 24 hours a day. Right. So even for, people who are not in a combat role, they're in like a combat support role. And most of the female, service members are in those types of roles. They can still be exposed to multiple traumas, and it's like every day there could be something, they're in a risky area, So there is something very different about being in the chronic situation of like that continual exposure to having your life at risk versus a one-time traumatic incident.
Okay, gotcha.
So that kind of makes it different. Also for female veterans, there's the issue of military sexual trauma, which, is is different in many ways from sexual trauma that might happen in civilian life, particularly because there are a lot of reasons that people wouldn't report that while in the military.
Right.
You know, they don't want to have people not believe them or, you know, have some sort of negative consequence happen. They might be kicked out or they might be, you know, treated differently or, you know, so, a lot of times that isn't reported and, you know, that's very prevalent, unfortunately. So, you know, sometimes we'll have people who, you know, have their SCI. We're seeing them for that, but they may have had a trauma earlier in their lives and going through the SCI and feeling like many things are out of their control can trigger some of those earlier, that traumatic distress.
I could see that.
You know, so for women, you know, if they have been through that military, sexual trauma, that can happen too. The other thing I was going to say is that, it's actually kind of surprising. So thinking about the trauma of SCI, and what a huge change that is for people. And, you know, you're dealing with pain, you're dealing with being in the hospital, but the incidence of PTSD for people, with SCI because of the SCI is only about 6%, which is similar to, you know, having PTSD from a different type of trauma. So that's pretty similar.
Okay.
But depression, on the other hand, you didn't ask about that, but that's one of the other, you know, kind of big things that we deal with in terms of, you know, psychological diagnoses, is more prevalent for people with SCI. So, the rate for the general population is about 5%, but it's about 25% for people with SCI.
Interesting.
So that's quite a bit higher. So people are more likely, if they're going to have, you know, a more significant, clinically significant, psychological problem, it's more likely to be depression than PTSD or anxiety.
Oh, okay, that's good to know.
Yeah.
Wow.
So
Yeah, I
is that
have
surprising?
a question.
Yeah.
It is. How long can an SCI individual be psychologically afflicted by that, by their physical injury?
Yeah. Well, obviously it's different for everyone. And I think it psychologically changes you forever, you know? And I think some people, you know, it's a lifetime negative change, you know, that they somehow don't find a effective way of coping psychologically, ever. But the majority of people, do come to a place where they feel like, you know, that new normal, of their life is something they can cope with. And, you know, they find ways to be satisfied, with their lives. And, in thinking about that, just in my personal experience, it seems like the people that do really find a way to be satisfied with their lives are the people that can identify something that is, meaningful or important to them in their lives. And it may be similar to something that they found important before their injury, and maybe something completely new. But, you know, it could be work, it could be school, it could be, volunteer, activities, it could be involvement with a church community, other creative pursuits, you know, but something that really, that they're passionate about.
And that could probably help
know?
divert, you know, their focus on the actual situation a little bit.
Right. Well, it's more like, you know, your life, doesn't have to be about the injury.
Right.
And what else do I want my life to be about? You know, what's important? What do I care about?
Right.
Yeah.
So it's
You know.
really important for someone to like become more socially integrated, like quickly after their injury, as opposed to, you know, sitting at home alone.
Well, I think, again, people are different. I feel like I'm saying that for every question. Everybody's different. But, you know, some people are naturally not as social.
Right.
You know, and so before their injury, they weren't social. We wouldn't expect them to be more social after.
Right,
You know,
yeah.
people's personalities don't change that much. But I think, first of all, a lot of things happen in terms of that transition between being discharged from the hospital and going home. Right.
Yes.
So, you know, you're getting used to caregivers, you're getting used to family members adjusting, you know, children, you know, just all those dynamics happening. And, so I think it really takes time to get used to that new routine and just kind of saying, okay, you know, I think I got a handle on this now, you know, and I think that time frame is different for most people. So I wouldn't be able to say like what's normal for that, you know, but, while patients are in rehab at our VA, they, as part of their treatment plan for acute rehab, they do go on outings, with different therapists. So we have recreation therapy involved and also, usually occupational therapy.
Good.
And so, they do things that are kind of functional and things that are enjoyable. So, they'll go across the street to Ralph's to the grocery store and have that experience, and they'll take a bus ride, for the first time, and go to Angels games, So to have that experience, being out in the community for the first time, with their disability, but, in terms of kind of like barreling out into life and saying, okay, I'm going to have my life now. I think you kind of have that initial letdown when you get home from the hospital, and then it's like, okay, let's get on with the next thing.
How does, peer interaction, help or, allow us to deal with this psychological injury? You being, in the peer, interaction program.
Yeah.
Sure, you have a good perspective on it.
Yeah. Well, thinking about like community integration, made me kind of think about that and the role of peer support. So I've had people tell me that, after they got into their routine at home, they still weren't really like living life. Yeah. They were doing okay. They weren't terribly depressed. They weren't, but they just were kind of there.
Right.
And it actually took an experienced SCI person to say, come on, we're going to the movies, or we're going, literally like dragging them out.
It's true.
And saying like, it's not going to be so bad.
I used to drag Ricahrd.
People tell me that all the time, So, I think the other thing too is that, most people who experience an SCI and are in the hospital, first of all, have not ever spent much time in a hospital. Most people are like, oh, what's this going to be like? And it's all new. But then also they usually haven't had any personal experience with disability at all. So there's like no clue as to what that life could really be like.
And that's, actually leads into my other question, is do you find that the internet and social networking a good tool to help people not feeling so isolated and closed in?
Absolutely. Yeah.
And do you know any good ones?
I think I might have heard of one that's locally based. But, I think that, we're kind of spoiled at the VA because we do have this, this great SCI center that's one of the biggest ones in the VA system. And so we have this community of VA, veteran SCI individuals who know each other, they see each other when they're coming in for outpatient therapies. They do activities together. We've got, social things going on at the hospital. So, we have that support there. Also California is has very disability friendly weather, and it's more accessible than other, I've had people that, they relocated out here after they were injured, because of the STI center and because of the weather, but,
mostly the weather.
You're right.
That helps.
But there are also people who live in rural areas or people who live in places that are just not as physically or architecturally accessible.
Right.
To people with disabilities. And
do you wanna?
So they don't leave their homes as often,
Right.
And so for those people in particular, I think it's so important to have this lifeline, you know, and that's what Push Room can be. It's a lifeline for somebody that feels like they're the only person going through this, or maybe they have a lot of support around, but those people don't really know about disability.
Right.
Have that community around.
Yeah. So
that's frustrating.
Yeah. So even if it's one person that they end up kind of talking with or getting some tips from or whatever, even knowing that there's one person there that they could reach out to.
Right. And also, in transition to that, the SCI Peer Mentor Program, is called the Social Hour. Can you briefly tell us about that?
Well, yeah. So, 2 years ago, I created our program, using input from other peer mentor programs around the country. So there are a few other ones, out there. So what we wanted to do was provide a more structured, way for that peer support to happen, because it happens informally a lot. People they're waiting for their ride home and, they end up talking to the guy next to him, or girl, woman. So we have about 12 mentors that I put through a mentor training program, and we use them in several different ways. So first, new injury patients who are there for acute rehab can ask to be assigned to a mentor who has a similar level of injury, and they might just meet with them once, for just a one-on-one, or they might continue meeting with them regularly after they leave the hospital. It just kind of depends on how well they fit, and if they like each other, and,
Makes sense.
Yeah. And then, we also have mentors who sit in on our weekly support group that we have. That's a small group. And then all of our inpatient rehab folks are required to attend like a new injury class that it's more informational. And so we have mentors come to that as well to kind of talk about the program and, just give like the 5-minute version of their injury story. And
I like the way you say social hour, because support group has a bad stigma amongst people, especially if they're not educated on what it is.
Exactly. So the social hour actually is different. So that's a once a month thing, and it's a bigger event. So you guys have been to that one, and we have like an invited speaker. So sometimes it's people from the community like you guys. Sometimes it's one of our SCI veterans, just kind of giving an extended version of their story and what their life is like now, And then we have time for kind of socializing and networking, providing other information, and that's where I really see like the mentoring happening, because after everybody's finished with the microphone and whatever, you see these little pairs, these people getting together and talking, it's like, oh, good, that guy's talking to somebody.
It's true. Now,
it's awesome.
Dr. Fraley, I can't help to see that throughout this conversation, your face lights up. Right? in how's working with SCI people, I guess, change the outlook of your life, and right along those lines, and what would you say has been the most rewarding part of your career as a professional dedicated to SCI individuals?
Well, I love this question. So I think, mostly it's raised my awareness of disability issues in general, and just helped me have a broad view of how to make important things in life accessible to any individual. And I was thinking about this. I remember a patient that I had, when I was an intern. So I did my internship, like the last year of my doctoral program at the VA. And, I met with this patient, and he referred to me as a TAB. And I said, what's that? And he said, it's a temporarily able-bodied person. And I said, oh, and that kind of like blew my mind, I was like, whoa, okay. And so he talked more about it. But the truth is, like, everyone on this planet, if they live long enough, will experience some sort of functional limitation or disability.
Right.
Just statistically, that's, so it's really a universal issue. And, also thinking about how it's sort of affected me, I think my professional work has absolutely affected how, I'm raising my son and educating him on disability and difference. So, having a disability is another way of being different, and, it's important to respect people's differences and, kind of understand them, and,
That's very nice where you could share that with other people, like family, because they also are curious about it, and
absolutely.
It's an educational process.
Yeah.
I'm wondering if he wouldn't mind if I stole that term, TAB.
Oh, not at all.
Because
it's not copyrighted.
I think we're going to be all using it today.
Yeah. Well, Dr. Fraley, all this stuff is really, we could sit here for 2 hours talking about such of these great conversation with you, but I didn't know all this.
We could do part 2, maybe.
Yeah,
later.
we can do part 2, because we might need that, because there was a lot of great information you were able to share with our community. Awesome. And we learned some stuff today as far as, all these great questions you had. And again, we want to thank you for taking time out to, to be part of our show and our community. And any particular place people could maybe look up some information about the VA or yourself or anything?
Ooh, that's a really good question. I should have a website available. Google the Long Beach VA.
Okay.
SCI Center. Like I said, it's one of the biggest ones within the VA system. So we're always looking to improve things, and part of that, which going back to your question, Boris, in terms of what's rewarding for me, the peer mentor program is something I'm really proud of, and I feel like it's something that none of the staff can provide. Right. We can't provide that experience of being in your shoes. Right. And so that's something that I'm really looking to build. And find other ways to use our mentors.
Good for you. We applaud you for that.
Yes.
Thank you for doing that.
Thank you very much, especially for these veterans that are so dear to all of us for what they've done, and they've given
their lives
and their lives for us. So thank you very much.
Thanks a lot.
Appreciate that.
So
You're taking
rich.
care of people who take care of us.
I believe you guys know where to reach us, but just in case, we're at our YouTube channel. It's Club Pushroom. That's one word. You just go on YouTube and type that in the search bar and we'll pop up.
And for the social media one, it's pushroom.com.
That's right. That's where everyone makes connections with each other and picks up ideas and makes new friends. And also check us out on iTunes. We're also there. And any information you guys want to talk about, leave a comment down below. If you guys want to reach us directly, you could reach us at info@pushroom.com with any show topics or, creative ideas so we can make our show a lot better for you guys. And again, remember, there's always life after injury. Get out there and live life. Team up with friends and learn from each other, and it's going to take you a long way into getting your independence back and, living your life. That, at the end of the day, that's what it's all about. So we thank you guys for having us. Thank you, Dr. FRALEY, for being with us.
Thanks a lot, you guys.
Thanks a lot.
And
We'll do it again.
Thank you for all the work that you do.
You're welcome. And so we'll see you guys once again on our next episode. Thank you. Peace out.
All right.
Bye.